I'm back again. Thank you for being here, and I just wanted to share a little bit about our experience with skeletal dysplasia. For some of you, it may be something that you are about to go through some of these surgeries, and for other people, you may have already been there, you may have done that. And so I just want you to know that you're not alone in dealing with some of these issues. Through this experience, it's made me a lot wiser and a little more patient and very grateful for my daughter, Anabelle. It has been pretty tough. We've dealt with her skeletal dysplasia from pretty early on. Our daughter Anabelle was born on May 30th at a healthy weight of 10 pounds, 8 ounces. She was huge and was born with what we call skis on her feet. They were huge. The first few months was your regular baby boot camp with Austin and I feeling totally overwhelmed and exhausted as first-time parents. But by the 4th month, our family story began to unravel as something very different, something very different than we had imagined in our family plan. The first sign I noticed was a very sharp curve in her lower back at 2 months, which we know now as kyphosis. It was apparent only when I held her up to my shoulder for burping. I could feel it on her back. I knew it was there, but I didn't mention it until our 4-month baby checkup appointment. The next day, we were given X-ray. We were told to go get X-rays. The next day, I was at Children's Hospital getting those X-rays. And after the X-rays were done, the radiologist came out with the fellow and said, "I'd like to see your child. Do you mind if I show my fellow your child?" And that was that moment when, your blood runs a little cold and you're pretty much frozen and thinking, why do you want to see my child? And why are you showing my child to a fellow? And at that point, they wouldn't tell me anything, but sent me home and said they would have my pediatrician call me in about 24 hours. As I was walking in the door from that appointment, the pediatrician was on the phone and talking to me about that they did see about 3 or 4 different differences in her bones, and they thought most likely it was an MPS, and we began our diagnosis process. Initially, we thought it was some of the other MPSs. The one being MPS I was kind of where we were at first. So by 6 months, we had our diagnosis, and it was confirmed that Anabelle had Morquia syndrome. The first thing we were told to do is we needed to see an orthopedic surgeon as soon as possible. And one thing that Austin and I, my husband, we had decided is we were going to leave no stone unturned when it came to our child's health care. We were going to absolutely, without fail, find the best doctor and the best orthopedic surgeon that we were comfortable with, that we could trust, and we were going to search far and wide for that and travel if we had to. Fortunately, we found that pretty quickly. I wasn't going to tell you this part, but actually it was interesting. Austin had seen a picture of Dr. McKenzie, is our orthopedic surgeon, holding arm in arm with another MPS researcher, and we thought, oh, we should check this guy out, and we made an appointment, and then my brother, who is orthopedic surgeon, he was a fellow, and he was actually going to a conference in California for orthopedic surgeons. He called me up a couple weeks later and he said, "You have got to go to this orthopedic surgeon. All the surgeons here are talking about this one guy that does amazing things with skeletal dysplasia. He is the guy. You've got to find him." Said his name, and I was like, "Oh, thank God, that's the one we're seeing." So, I found out through other avenues that he was the right guy to see. I put up this picture, and as you can see a little bit in that first big picture of her sitting in her diaper, a little bit of the kyphosis. That was the first sign that we saw. But as you can see, she looked pretty normal otherwise. Our first surgery was the cervical decompression infusion. She was just before 2 years old when we knew that her cervical spine was being impinged in her cervical area, and there was also some storage buildup. Even prior, we had already actually had the surgery on the schedule because we had seen that in the X-rays. But Anabelle, just before 2, I went in to pick her up out of the crib, and she was screaming and wiping out her arms, and and I didn't know what was going on. It was very strange. I knew she was saying things like bugs. I can't remember her exact words because she was very young, but she was feeling that tingling, and of course I called the doctor or his nurse, and we did get up to get that surgery done pretty quickly after that. The actual surgery took several hours. It's a very long day. It is very emotionally exhausting and emotional. But after several hours, she did come out. It was successful. She spent a couple of nights in the ICU. This picture is which I decided to go on and put up. It's a pretty emotional picture for me. It's the first thing that we saw when we went in and saw her in the ICU. And you don't know my daughter that well, but her face is pretty swollen, and that's pretty overwhelming when your daughter you come out of this surgery. And they had told me there would be swelling. I didn't realize that much swelling, and it's because during the surgery they're turned face down, so there's a lot of accumulation into the face. But this was the first thing that I saw when I came in. Thankfully, she was still a little bit asleep, so I had my moments of a lot of crying, and then I pulled myself together, and as soon as she opened her eyes, I was able to give her a big smile and tell her that everything was going to be just fine. Following this surgery, the first thing that we had to do after a few days in the hospital, we were sent home and had physical therapy ready to go. This is Anabelle doing her physical therapy. Part of this is learning how to balance with the halo. She's only 2 years old in this picture. And she very quickly, after about 5 or 6 visits to the physical therapist, learned how to get up, get down, pick things up, roll from one side to the next so she could maneuver in the bed. She loved the swing. That was one thing she really enjoyed. And really, after about only 3 weeks of having that halo on, she was moving around and doing everything that she was normally doing. Of course, some things like getting in and out of the car and that sort of thing, she obviously needed a little help in making sure she didn't lose her balance. So life with the halo and our recovery was great. It went just fine, and we even decorated the halo. And as you can see, we had play dates. She could sit on the floor and read books. She's playing peekaboo in that picture. And we even went through Halloween. We dressed her up as a little doggy. And right before the halo came off, I had our second child. So yes, you can do more than just deal with the surgeries. We managed to do having a second child in the meantime. Sorry. And also, if anybody is about to go through the halo process or this surgery, I've came up with a very easy way to fix your clothes so that you can pin them up all around the halo and not get crumbs down there. So if you need that, just let me know. Our next surgery we knew we were coming up to was at just before 4 years old. We really knew that there was a lot of pain in her hips, a lot of pain in her knees. She was not playing as much as she would like the other kids. She was pretty much on pain management day and night, and it was really awful to watch. I put up this illustration just to show you at 7 months you really can't see anything. At 1.5 years you can kind of start to see a little bit of that, and by 3 years old it was pretty clear that her knees were starting to drift inwards. This is her in her hip spica cast. It is a 6-week recovery. You think the halo's scary? The spica cast was pretty tough. But you get through it. It is a limited amount of time. It was 6 weeks that she was in this full body cast. It's hard for everybody in the family, and you really do need a good support system to get through this. You really can't leave your child alone during this time because they can't do anything. They can't even inch their toe should it be something on it. So that part, you had to have a support system to get everybody involved. My husband's taking a picture of me. Sorry. Okay. And like the halo in that recovery, we just decided we needed to carry on with life as best we could. This first picture is just to show you, this was after her first hip reconstruction. They do one side, and then they did the second side a week later. So just to show you that that was the process for us. It was about 2 weeks that we were at the hospital. And before we left, Anabelle got to choose a color to put on her cast, and she chose the bright tie-dyed color, which was really cute. So they added that color on to make it more fun. She even went on a movie date with a little boy down the street who invited her to go to the movie. We put her in a wheelchair and we went on to the movies. Here's her and her sister down at the bottom in the middle playing. And even, and I don't know if Dr. McKenzie would approve of this, but she was writing on Anabelle's cast. But sometimes when you're one person and you need to push two kids, you got to make do. After we got the cast off, I wasn't aware of this, but you know, there's this whole other piece of rehab that was involved, and it was pretty intensive and it was long. When we were told initially, you know, when she got the cast off, there would be muscle atrophy. She would definitely need rehab and pretty intense. So we took the advice. We did it. We were told it is much better to do it on the front end. If you wait too long, the recovery will just take so much longer. So we did. I had it set up. We were in land and water therapy most days of the week. And after the first 3 months, she was doing a lot of things on her own. We weren't quite back to our baseline. About towards the second 3 months, we pushed back some of we didn't do quite as many days, and she did better and better. I mean, every month you could just see the improvements. She was not complaining of pain. She was feeling good. She was doing things she had never done before. And this picture actually is just a few days after she had her cast off, and she was absolutely scared to death to do any sort of weight bearing on her legs. So my husband and I decided, well, let's just have a party, invite all our friends over, and see if that encourages her to get up and get on the walker. And she did, actually. We didn't say anything. About halfway through the party, she decided she needed to show off, and she got on that walker, and here she is. She did a couple laps around the house and even did an arabesque. So after a year, post the hip reconstruction, she is by far surpassed any abilities she was able to do before. She can walk faster, walk farther, but best of all, it's the no pain aspect that we are so happy about. And then this is the last slide that I have, which a lot of that I already said, but I'm happy to chat with anyone that has questions about how to prepare for this. You certainly need different clothing and different things in your house, like bean bags and places to put your child in different stations, and I'm happy to share what we did that worked for us. Thank you.